World Health Organization team has visited a hospital where China says the first COVID-19 patients were treated more than a year ago. It's part of the WHO's long-awaited fact-finding mission on the origins of the virus. Let's cross now to Charles Pellegrin in Beijing. Charles, so far, what has the team actually managed to see on its first day?
Well, they came out of quarantine on Thursday, and this Friday they started their mission by having meetings with their counterparts in the Chinese scientific community. And after that, they headed to one of the hospitals in Wuhan, one of the first to treat the first cases of COVID-19 that appeared in late 2019. And during that visit, the 10 experts of the WHO mission said that they spoke to clinicians at the hospital, to staff, asked them questions about what happened in Wuhan in late 2019, early 2020, what they had to deal with during that initial outbreak. And they insisted on the fact that this was a frank and open conversation. We don't have more details on the exact itinerary that they'll be following over the next 2 weeks, but we know that they will be also visiting the site of the Huanan food market that's been closed since January and completely disinfected, and is considered to be the epicenter of this pandemic, and where there were stalls that sold wildlife. And they'll also be visiting the Wuhan Institute of Virology, which is at the center of many controversies because of the theory that the virus may have leaked from this lab. This is a theory that's been put forward potentially by the United States and the Trump administration, relying on intelligence from their side, saying that there were lax security protocols there. This is a theory that's been completely refused by the Chinese side. So the WHO investigation will be in Wuhan for 2 weeks, trying to parse through all these facts, all the data that they'll be seeing, in order to get to an idea as to how the virus went from the animal realm to the human realm, and all that at the invitation of Chinese authorities.
But of course, all these events happened over a year ago, Charles. So how much will they be able to really find out?
This is an important point to make. Absolutely. Some of the interviews that they'll be conducting with patients of COVID-19, with doctors, will be relying on people's memories, which are not reliable, especially if they have to remember things that happened over a year ago. Places that they visit might have changed over this time, and this brings a number of issues, a number of problems with this visit. And then there's the issues with China trying to exert pressure on some of the interview subjects, on some of the doctors. China's been extremely cagey about its own findings over their own investigation in the origins of the coronavirus, and they've even tried to silence some of the independent investigations that have taken place since the beginning of this outbreak. So they're going to have a tough task ahead.
Charles Pellegrin reporting there from Beijing. Thank you.